Welcome to the BJN Awards 2021. This year we're coming socially distanced, of course, from the beautiful Royal College of Physicians. If there ever has been a year to celebrate excellence and innovation in nursing, it's this year. The pandemic has shone a spotlight on nursing and has highlighted what an incredible, committed profession you are. While we knew that already, it's great to see that the wider population is increasingly aware of the vital role that nurses play in the delivery of healthcare. We're honoured to be able to recognise the fantastic work you're doing, pushing boundaries and improving existing practice for the benefit of patients in what is an exceptionally challenging time in healthcare. We can't thank you enough for the work you're doing. It's such a privilege to be a judge for the BJN Awards. We were really overwhelmed by the calibre and volume of entries this year. To have made it through the shortlist is an enormous achievement in itself, so you should all be very proud. It's now time to welcome my co-host for this evening. Many of you will know him from BBC's Strictly Come Dancing and the CBeebies show Get Well Soon. It's Dr. Ranj Singh. Hi Dr. Ranj, nice to see you.
Hi, thank you for having me.
Thank you for being here.
Hi everyone, my name is Dr. Ranj Singh and I want to thank you all, especially the BJN, for having me to host today. For those of you who may not have had the dubious pleasure of working with me, I work in various roles as a TV presenter, a relatively recent author, a magazine columnist, charity ambassador, and above all of that, I am an NHS emergency paediatrician based in London. I've had quite a varied medical career over the last 20 years or so, but my one constant has been the friendship, support and guidance of my wonderful nursing colleagues. I still remember my first ever weekend on call as a brand new junior doctor, and the lovely ward nurse who took pity on an anxious, sweaty house officer with the look of a deer in headlights, took my bleep off me and told me to go and have a break. When I started my career in paediatrics, not too long after that, it was nurses that helped me find my feet in a speciality where I felt completely out of my depth to start. And more recently, working in paediatric intensive care, specialist nurses have taught me and given me the confidence to be able to look after the sickest children. They are the reason I am able to do the job I do today. And then there were fun times too. Christmas parties, ward nights out, the morning after night shifts when we'd all go out for a boozy brunch somewhere. Every step of the way, nurses have been my colleagues, teammates, teachers, mentors, saviours, party pals and best friends. I even sung at one of my nurse besties' weddings. 2020 was the year of nurses, and quite rightly so. We wouldn't have a healthcare system without you, and we wouldn't be able to tackle this pandemic without you. We owe you all so much and are incredibly lucky to have you. Nurses are the backbone of our NHS, and today we celebrate your compassion, courage, camaraderie and clinical achievements.
Thank you for those lovely words, Ranj. Now it gives me great pleasure to hand over to our wonderful Editor-in-Chief, Professor Ian Peat. He has been an inspiration to many nurses and is also a proactive and untiring support for me and the whole of the BJN team. Over to you, Ian.
Thank you, Sophie. Hello everybody, it's my privilege and delight to once again address you all as we begin the well-respected and celebrated British Journal of Nursing Awards 2021. The surreal situation we found ourselves in 2020 at the last BJN Awards continues during these incredibly challenging times. I'm very lucky to work with a team of publishers who genuinely believe in connecting specialist audiences such as yourselves with critical clinical information. I'm privileged to work very closely with our editor and associate publisher, Sophie Gardner, who has provided me with much support over the years. Thank you very much, Sophie. Thank you, Mark Allen Group. The BJN Awards are well regarded within and without the profession, and they would not be possible had it not been for you amazing people who are making a skilled response to the fast-changing nature of this pandemic. You are incredible. I am truly in awe of all you do. You make people your priority. The honour of being able to judge the awards again this year in circumstances that have been very chaotic for nurses up and down the country has been absolutely amazing. Despite the challenges, the profession has continued to provide outstanding care and support to individuals, families, communities and nations. You continue to push at the boundaries and to strive to innovate and be creative in offering diverse communities care and support, ensuring that every contact counts. These awards are the evidence of all of this. The coming together of the science and the implementation of that science is what nurses do. This is not something new for nurses. It may be that over the last year or so it has hit the headlines. Nursing is about what nurses do best. They nurse. You have explicitly and overtly demonstrated to the nation your compassion, commitment, courage, confidence, caring, and your outstanding ability to communicate in unheard of circumstances. Not that you needed to do that, not that you needed to justify your existence or your role, but what you need to know is that what you have done has not gone unnoticed. We know that you are overworked, understaffed, and possibly heartbroken and anxious, but you are always courageous. We salute you all and we remember and pay tribute to our colleagues who have lost their lives as a result of COVID. We also remember their families. These colleagues lost their lives whilst caring for and protecting patients. Each lost life during this pandemic is a tragedy. We must ensure, indeed we have a duty to ensure, that our nursing and healthcare colleagues are remembered and not forgotten now and in the future. We will not forget them. As the number of confirmed cases of COVID-19 remains high, nurses find themselves making high-stakes decisions for patients and their own personal lives, and they will continue to do this until we exit this crisis. Our student nurses, who are following in your footsteps, our next generation, are learning in settings and situations that are challenging for the best of us. But they are progressing and they are developing at pace due to their grit and determination, as well as the supervision that you are providing them. You are role modelling true professionalism. You are, as best you can, minimising any disruption to student learning. The contribution that our student nurses are making, we should all be grateful for. What continues to perplex me, however, is where are the nurses? The nurses that are so often cited at government press conferences as the backbone of the health and care system, yet they remain absent from these press briefings. I will never shy away from political rhetoric. I will never shy away from saying again and again and again, you are still not paid enough for what you do. Just as you do not shy away from your outstanding selflessness, your outstanding contribution. What you do is the science. What you do has saved thousands of lives and offered comfort to thousands of people. Yet you are not seen at the press briefings. You are absent. You do not sit on government advisory groups such as the Scientific Advisory Group for Emergencies, SAGE, which I find quite astounding. It would appear to me that this think tank, SAGE, that plays such a central role in policy development, has missed a trick. They did not think. There are many lessons to be learned here. Nurses know and understand how healthcare systems actually run. They provide the critical eye. You have remained unwavering in your aspirations to prevent the transmission of coronavirus, as well as other infectious diseases. You continue to be fully engaged in caring for those who are suffering. You are at the forefront of health protection. You continue to participate in the rehabilitation processes and rehabilitation programs. You remain dedicated to the supervision and support of learners who come to you to learn from you from all spheres of the health and social care spectrum. They're learning from the experts.
Hello and welcome again everybody to the British Journal of Nursing Awards. Once again, this year we are bringing the awards to you virtually, but this time as a week-long celebration. The BJN is in its 30th year, and these awards have been going for a good chunk of that time too. As the publishers of the BJN, we are committed to the provision of accessible, educational content to improve practice, and through these awards, we are committed to highlighting and acknowledging the amazing work that you, our nurses, do. It has been a year that none of us would have ever foreseen, which has presented challenges beyond anyone's expectations, not least for the healthcare workforce and of course for you, our nurses on the front line. I know that I speak for everyone when I say that we are indebted to you, and for that, thank you. More than ever, these awards are so important to recognise and reward the incredible work that you do. So before we get started, I just wanted to quickly say a few thank yous to everyone involved who ensure that these awards can happen. Thank you first and foremost to you, the nurses. It is your remarkable work that brings us all together. The entries that we have seen for this year's awards have been truly inspiring. Thank you also to our judges. It is no small feat to review and judge all of the entries, so your time and efforts in doing so is very much appreciated. I'd also like to extend my thanks once again to the multiple nursing groups and societies who we are so proud to work with, and for your collaborations with us on these awards too. And finally, thank you to the sponsors. Without your support, none of this would be possible, so thank you. I will now hand over to John Orchard from our supporting charity, the Cavell Nurses Trust. I hope you all enjoy the evening and the rest of the week, and please do join in with your comments, congratulations and tweeting. And for the tweeting, use the hashtag BJN Awards.
Hello, I'm John Orchard, Chief Exec at Cavell Nurses Trust, and a big thanks to the British Journal of Nursing team for the chance to celebrate with you all at the 2021 BJN Awards. We are very proud to be sponsoring the Innovation Award at this wonderful event. Many of you will know Cavell Nurses Trust is the charity supporting UK nurses, midwives and healthcare assistants, both working and retired, when they're facing a personal or financial crisis. This is very often due to illness, disability, domestic abuse, and over the course of the last year, the huge impact of the COVID-19 pandemic. The past year has turned things on its head for so many of us, for your teams and I'm sure for your loved ones too, and it's been an unprecedented year for a small charity like Cavell Nurses Trust too. From March to December last year, we saw a 175% increase in the amount of people needing help compared to the same period in 2019. One of those people that we were able to help was Marithel. She was working for a nursing agency and was enjoying her busy shifts, until the COVID-19 pandemic hit the UK in March 2020, when suddenly she wasn't needed and nursing shifts became unavailable as hospitals in her area cancelled routine procedures. I couldn't work, remembers Marithel. We had no money coming in at all. We were thinking, where do we get money to buy food? How will we eat? It was the most scary thing that has happened in my life. Cavell Nurses Trust was able to quickly get money to Marithel, enabling her to pay for bills and buy food for her family, and this has made a significant impact in their lives, of course. Marithel reacted, "As a nurse, you're always helping others, so you never think that you will need help yourself, and I'm so pleased and grateful that there is a charity out there dedicated to supporting nurses and other healthcare professionals." Nursing and midwifery staff are being called on again to face COVID-19 on the front line, and despite this, they will continue to need our support, and we don't see that changing anytime soon. In fact, just last month, we had matched the value of grants given in the whole of February 2020 within just the first 5 days of 2021's February. In this uncertain climate, it's essential that Cavell remains on hand to support nursing and midwifery professionals in need, and the team at the charity is determined to create meaningful, long-term support for this precious healthcare workforce. So, here's a way that you and your colleagues can help us to support nurses, midwives and healthcare assistants right now. We'd love to encourage people to donate today, and it's really simple. Please just text HELP NURSES to 70085 and you will give £10 to Cavell Nurses Trust, helping us to make sure we're here for the nursing and midwifery family throughout the UK. Text costs £10 plus one standard message rate. If you have any questions, please do get in touch with us via our website or social media. The team and I would love to hear from you. Thank you for listening to me, and let's have a wonderful event.
The awards are open to an individual or team who have made a significant impact on patients in their care in their respective areas. Right, it's time to announce the winners of the BJN Awards 2021. So let's begin. The first award this evening is the Stoma Care Nurse of the Year. The formation of a stoma can be a distressing and painful experience for a patient. The stoma care nurse plays a vital role in ensuring they are well informed and aftercare is managed appropriately. This category is supported by the Association of Stoma Care Nurses and Gastrointestinal Nursing. The award is kindly sponsored by Hollister and Dansack. On the shortlist we have Wendy Osborne from Coloplast. Wendy has contributed extensively to the improvement in understanding and care of those with stomas through research, launching the National Stoma Care Guidelines, organising conferences and producing literature to educate her colleagues. Helen Coulter, Respond Healthcare. Helen has undertaken a series of training programmes to help support external organisations in providing care for stoma patients with particular emphasis on care homes. She's also carried out training for security staff at both Belfast airports to reduce trauma for travellers with stomas. And Alison Roberts, also from Respond Healthcare. Alison has worked in stoma care for 33 years. In response to her own research, she has developed a pathway for Respond nurses, which recommends early intervention to support patients discharged from hospital with a new stoma, improving patient experience and providing a seamless transition from hospital to the community. To present the award, we will hear from our sponsors Hollister and Dansack and category supporter ASCN. Please, can you tell us the winner?
Good evening. It's a pleasure to be invited to the BJN Nurse Awards of the Year, and in my capacity as Chair of the Association of Stoma Care Nurses, it's always a pleasure to judge the award for the Best Stoma Care Nurse of the Year. We had several applications this year, and myself and Jenny Birch, who was the Educational Officer for the ASCN, thoroughly enjoyed going through the applications to judge them. We're always surprised by the innovation and the hard work that our members are putting in. So we would just like to say congratulations to all of the nominees and good luck to everyone.
2020 has been a most challenging year for nurses, but it's also been a year where nurses have been able to step up and provide a service that truly makes a difference to their patients' lives. And this is a value that we both share at Hollister. I'm therefore delighted that we are sponsoring tonight's awards, and I'm even more honoured as a stoma nurse to be asked to announce tonight's winner. But let me share with you the nurses that have been shortlisted for this award. The first shortlist is Wendy Osborne. Wendy is the lead stoma care nurse at Coloplast Limited. Our second shortlist is Helen Coulter, and Helen is a community stoma care nurse working for Respond Plus. And thirdly, Alison Roberts, who is nurse team leader for Respond Healthcare. I'm sure you'll agree that all three nurses are worthy winners, and I congratulate you all on being nominated for this award. However, we can only have one winner, and the winner of the British Journal of Nursing Stoma Care Nurse of the Year award goes to Helen Coulter. Congratulations, Helen. I'm sure that you'll be delighted to have won this award. Well and truly deserved. Thank you.
It's an honour and a privilege to accept this award, and thanks to the people who nominated me. To have been a finalist was amazing, and to be a winner is incredible. I've worked in the NHS for 37 years and I've now been with Respond Healthcare for almost 10. I'm very passionate about stoma care in the community and the smooth transition of patients from hospital to home. I think education of the patient, their family, carers and everyone who comes in contact with any ostoma is the key to success. And thank you to the British Journal of Nursing for this award. Thank you.
Thank you, Helen. Over to you, Sophie, to present the next category.
Our next category is Urology Nurse of the Year. The work urology nurses do, be it in infection, uro-oncology or long-term condition, is vital and deserves recognition. This category is kindly supported by the British Association of Urological Nurses, and we are delighted that the category is sponsored by Hollister. On the shortlist we have Jonah Rousser, Guy's and St Thomas's NHS Foundation Trust. Jonah has almost single-handedly transformed prostate biopsy practice across the UK by rolling out an initiative to introduce a biopsy process using local rather than general anaesthetic, providing a much safer and more effective diagnostic procedure. Kelly Kaczynski, the Royal Wolverhampton NHS Trust. Kelly has worked with great dedication within her team to redesign patient pathways and services for men with prostate cancer, whilst also mentoring new colleagues, with the result that cancers have been detected earlier and unnecessary biopsies prevented. And Elena Howard, Royal Cornwall Hospitals NHS Trust. Elena has been pivotal in developing the number of services provided by her clinic to ensure cutting-edge, safe and efficient care, whilst also developing her own practical skills, enabling her to offer urological nursing advice to healthcare professionals in the hospital and community. To announce the award, please welcome our judges from Bourne and our sponsor Hollister.
Hello, my name's Sarah Hillary and my colleague Sharon Arkless and I are both Bound trustees. This year we've been given the privilege of judging the British Journal of Nursing's Urology Nurse of the Year award. Now more than ever, it's been really difficult for urology patients to get the care that they need. Many patients have to pluck up courage and take their time to approach their healthcare provider to seek care in the first place, because many urology conditions can be very embarrassing and difficult to live with. So it's been particularly impressive that this year nurses have gone above and beyond the call of duty to try and make sure care is given to those patients where and when they need it.
Hello, I'm Sharon Arkless, Bound Trustee. Congratulations to all the nominees shortlisted. You are well and truly flying the flag for high standards in urology nursing. You are also highly commended for striving to improve services through innovation, service improvement and education to deliver high standards in patient-centred care. Congratulations, well done.
Over the past 12 months, we've seen the incredible work of nursing staff highlighted globally and across the UK, first by the International Year of the Nurse and Midwife, and then by the massive challenges posed by the coronavirus pandemic. COVID-19 has tested nursing probably like no other crisis, with nurses demonstrating their expertise, perseverance and innovation, whatever their specialty or setting. From everyone at Hollister, we congratulate all in the profession and ultimately thank you too. I'm delighted that we're able to sponsor the Urology Nurse of the Year award, whereby the shortlisted nominees are Jonah Rousseau, Guy's and St Thomas NHS Foundation Trust, Kelly Kaczynski, the Royal Wolverhampton NHS Trust, Elena Howard, Royal Cornwall Hospitals NHS Trust. Congratulations to all shortlisted nominees. Unfortunately, there can only be one winner, and I'm pleased to announce the British Journal of Nursing Urology Nurse of the Year award goes to Jonah Rousseau, Guy's and St Thomas NHS Foundation Trust. Congratulations, Jonah.
Wow, it's a great honor and privilege to receive the award Urology Nurse of the Year. I want to take this time to thank the team at Guy's Hospital and in the South East London Accountable Cancer Network for nominating me for the award, acknowledging the work that we have done in the last 3 years with LATP biopsies. I'm very grateful, and thank you to BJN committee for giving me this award. Thank you.
Congratulations, Jonah, and thank you to Hollister and the judges. Now, back to you, Ranj, to run through our next category.
Our next award is Gastrointestinal/IBD Nurse of the Year. With a growing number of people experiencing gastrointestinal disorders and/or IBD, the work of specialist nurses is becoming more and more needed. This category is supported by Crohn's and Colitis UK and very kindly sponsored by Takeda. On the shortlist we have Jenny Birch, London Northwest University Healthcare NHS Trust. Jenny runs several stoma and colorectal courses in conjunction with DANSAC and has developed bespoke modules for nurses to enable them to specialise in GI nursing to the highest level. She has effectively converted all courses to online delivery this year and is also involved in research at St Mark's Hospital. Maria Tan, the Royal Wolverhampton NHS Trust. Maria has been instrumental in developing a nurse-led and nurse-delivered 7-day day case paracentesis and infusion service within her trust. The unique service works as the front door, delivering acute care and preventing admissions for patients with GI conditions that need urgent infusions, transfusions and paracentesis. These were only possible previously via hospital admission, but over the last few years has become a completely day case outpatient service, which has prevented unnecessary admissions and delays to patients. And IBD nursing team, Royal Devon and Exeter Hospital. This team has maintained a high standard of service throughout the pandemic in spite of intermittent deployment, self-isolation and working from home. They have successfully transitioned to a new digital system and adapted their working practices to maintain patient safety, social distancing and shielding of the most vulnerable patients. To announce the winners, let's hear from category supporter Crohn's and Colitis UK and our sponsors Takeda.
Crohn's and Colitis UK are delighted to support this award again this year, which really highlights the often unsung valuable work that nurses working in inflammatory bowel disease and gastroenterology do. We were particularly delighted this year by the number of patients who nominated their nurses, showing just how vital nurse specialists are to patient experience.
We were extremely impressed with the 3 finalists, which include an outstanding team of IBD nurses who, despite redeployment and working from home, have continued to support their patients and run their service. Our next finalist has innovated a 7-day-a-week service for IBD, liver and anemia. They have been defined as trailblazing a unique advanced practice role and been described as a source of inspiration to their whole team. Our last finalist is an educationalist with many years' experience who has had numerous research papers published and has run many stoma and GI courses, all of which have now been moved online.
Hello everyone, my name's Craig Atkins. I'm the Business Unit Director for Gastroenterology at Takeda Pharmaceuticals. At Takeda we try to put the patient first in all of our thinking and initiatives, and that's why we're so proud to be able to sponsor the IBD Nurse of the Year Award. I should say a big congratulations to all those shortlisted. No small feat, and you should all be extremely proud of yourselves, but there can only be one winner. And I'm delighted to say and announce that that is Maria Tan from the Royal Wolverhampton NHS Trust. So congratulations, Maria. Well done.
Thank you, BJN, for this award. I am truly surprised and humbled to be receiving this, to be recognized by colleagues, particularly be nominated by one of our respected consultants, Dr. Menon. I am truly humbled. To the Royal Wolverhampton Trust, the Gastroenterology Directorate, Ward C41 and the Gastro Day Case Unit, this goes to all of you, Bev Morgan and Dorian Black. I would want to mention you too. To my family, you are my constant inspiration and rock. Raising the profile of nursing and gastroenterology has always been my passion. Putting the patient first and putting them at the heart of everything we do is what I intend to do. So once again, thank you.
Thank you and congratulations, Maria. I'll now hand back to Sophie to present the next award.
The next award is the Cardiovascular Nurse of the Year. Heart and circulatory diseases like coronary heart disease, stroke or vascular dementia affect millions of people in the UK. This category is supported by the British Journal of Cardiac Nursing. On the cardiac shortlist we have Community Specialist Heart Failure Team, Swansea Bay University Health Board. When faced with chronic under-resourcing, increased prevalence of heart failure, complexity of patients and advances in therapies, this team used COVID as a catalyst for change. By increasing specialist skills and delivering a proactive and responsive service, they were able to bring about measurable improvements in patient care. Rosalie Magbu, Barts Health NHS Trust. Rosalie has been an innovator in pursuit of furthering compassionate and holistic cardiac surgery patient care, including the development of a care bundle to prevent post-operative atrial fibrillation and a tool to prevent cardiac surgery site infection. And Mark Green, Portsmouth Hospitals University NHS Trust. Mark addressed the issue of patients' fear of hospital admission due to the COVID pandemic by setting up an ambulatory clinic to support high-risk patients. This helped to prevent admission and to improve quality of life and overall prognosis for many patients. To announce the winner, let's hear from the judges.
It is my great pleasure to be here to announce the winner of the Cardiovascular Nurse of the Year. Cardiovascular nurses make a difference across the life course for people living with cardiovascular disease. From prevention to acute care to rehabilitation and palliative care, cardiac nurses are there to ensure that care is patient-centred. This year, we have received a number of nominations for transformative care that occurred as a result of the COVID-19 pandemic, and I commend every one of our nominees for their exceptional work. But without further ado, I would like to announce the winner of this year's award, Rosalie Magbu. Congratulations, Rosalie.
Good evening, ladies and gentlemen. First of all, thank you very much to the organizer of this year's BJN Award. I'm extremely honored to be receiving such an important award as the Cardiovascular Nurse of the Year. I'm truly grateful for the recognition that I received for my works. I'm very sure that every other nominee is as capable, if not more, of winning this award. So once again, thank you so much.
Thank you, and many congratulations, Rosalie.
Our next award is the Chronic Edema Nurse of the Year. Professionals working in the field are clear that chronic edema and its treatment demand a higher profile within the NHS, and that everyone has the right to accessible and effective treatment. This award is supported by Lipedema UK and the British Lymphology Society. On the chronic edema shortlist we have Catherine Taylor, Manchester Local Care Organisation. Catherine has been instrumental in the development of a new lymphedema service and has had significant success in addressing the needs of patients with learning disabilities. She has also contributed to an education package for community nurses, GPs and podiatrists, improving patient outcomes for those with lower limb edema. Katie Riches, University Hospitals of Derby and Burton NHS. Katie has made significant contributions to the improvement of understanding and treatment of chronic edema, particularly in the development of guidelines to improve the way in which patients with cellulitis are managed. She has supported and encouraged colleagues and shared her knowledge nationally and internationally. And Anna Swinburne, Accelerate CIC. Anna has used her knowledge, experience and passion to improve patient outcomes for those with lymphedema, whilst also inspiring, educating and supporting her colleagues. To announce the award, please welcome our judges.
I'm Margaret Snedden. As Chair of the British Lymphology Society, it is my privilege to judge the Chronic Edema Nurse of the Year Awards. Entries in 2021 were outstanding and many more than usual, so it made judging a real challenge. Those shortlisted are not only making a significant contribution to the lives of people with chronic edema, but they're also influencing practice, locally and for some, nationally. I wish each of them well, because whoever wins this award will be a very worthy winner.
And it is on behalf of Lipedema UK that I was very proud to be asked to take part in judging this year's British Journal of Nursing Chronic Edema Nurse of the Year award category. Reading through this year's shortlisted entries, the achievements and innovations were truly inspirational, in particular over this very difficult year. This year's worthy winner has collaborated on many research projects and been lead author on key papers. Her work on breast edema and the development of the cellulitis guidelines are key in our best practice. I'm very pleased to therefore announce that the winner is Katie Riches, University Hospitals of Derby and Burton NHS. Many congratulations, Katie. Take care all.
I was very surprised to be nominated for this award and even more shocked to have actually been named as the winner. I'm very proud to work in lymphedema and work with such inspiring people, not only in our clinic, but the St George's team, and I've been really pleased to be part of BLS for the last few years. There's a great lot of nurses out there doing an awful lot of exciting work, and I'm very pleased to be part of the team.
Congratulations, Katie, and thank you very much to the judges.
Next up is Continence Nurse of the Year. Continence issues can have a profound effect on a person's quality of life. This category is supported by the Association for Continence Advice. On the Continence Nurse of the Year shortlist we have Community Urology Continence Service, Guernsey Health and Social Care. This small team has continually sought to improve the service and quality of care by responding to patients' needs and requests, particularly with regard to self-catheterisation, resulting in a much reduced levels in urinary infection and improvement in patient experience. And Community Healthy Bladder and Bowel Service, Swansea Bay University Health Board. This team developed a pathway to guide community nurses when assessing patients for trial without catheter, thus reducing the risk of patients having catheters for longer than necessary, and thereby reducing risk of infection. Now, to announce the award, let's hear from the ACA.
I was delighted to judge the continence category for the British Journal of Nursing Awards 2021. So thank you for inviting me. And after such a tricky year, nursing deserves recognition. And therefore, I'd like to congratulate all the entries for your hard work and passion for nursing. So well done to you all. I was so impressed that even in times of adversity, nurses are prepared to share good practice and strive to deliver excellent patient care. And it gives me great pleasure to announce the winner of the Continence category 2021, which is Community Urology Continence Service, Guernsey Health and Social Care. Congratulations.
Wow, this is a big surprise. On behalf of the Guernsey Health and Social Care Community Urology and Continence team, I'd like to thank you for this. It just goes to show that by listening to your patients and with good teamwork, you can improve the patient's journey. Thank you again.
Thank you and well done to our very deserving winners.
Our next award is for hepatology and liver nursing. Patients treated for hepatology and liver conditions have a range of life-altering conditions and diseases. This category is supported by the British Liver Trust, British Liver Nursing Association and Gastrointestinal Nursing. On the Hepatology Liver Nurse of the Year shortlist we have Catherine Higgins, Spectrum Community Health CIC. Catherine has helped to introduce and embed a hepatitis C elimination programme, which has significantly improved uptake of screening and patient outcomes. Working with community partners, she has streamlined the referral process and implemented an opt-out approach, more than doubling the number of patients screened. Nicola Monaghan, Nottingham University Hospitals NHS Trust. Nicola works tirelessly to educate staff and keep herself updated on the changes within hepatology in order to provide the best care for patients. She's always accessible to patients by mobile phone, enabling them to feel confidence in the service. And Dorset Hepatitis C Elimination Programme. This team has improved the delivery of care to a hard-to-reach patient group, including the homeless and those temporarily and vulnerably housed. They have overcome many challenges, mobilising quickly and simplifying processes to eliminate barriers to engagement and treatment. To announce the award, please welcome our judges.
Hello, my name is Rebecca West and I'm the Nurse Manager at the British Liver Trust charity. We support patients and their families via the UK's only nurse-led helpline service, and we answer all written medical inquiries that come into the charity, and we also manage our large forum with almost 25,000 members. As a nurse team, we've certainly seen our workload increase greatly since last March and the advent of COVID. And I know our colleagues nursing clinically have been under a lot of pressure this year. With that in mind, I was really delighted to have been asked to be one of the judges on the Hepatology Nurse of the Year Awards for the 3rd year running. It was really encouraging to view the varied specialist work that the nurses have done over the past year and how standards have managed to remain so high, with patient care at the forefront of everything that you do. I would really like to congratulate all the nurses in the category and also thank you so much for your hard work. Take care. Bye.
Continuing to provide and adapt a high quality service through a pandemic has been a real achievement of these winners. The opportunity to access normally hard to reach groups of people has allowed for increased testing and treatment of homeless people with hepatitis C through reducing barriers to engagement. I'm very pleased to announce that the winners of the British Journal of Nursing Liver Nurse of the Year is the Dorset Hepatitis C Elimination Programme team. Congratulations.
I'm Hazel Allen, Consultant Nurse in Liver Disease for Dorset. I'm delighted to accept this British Journal of Nursing Award on behalf of the Dorset Hepatitis C Elimination Programme and our amazing collaborative team working across primary and secondary care, drug treatment services, local government, public health, the Hepatitis C Trust and Hep See You Later. We had fun working together and we're very proud to have our team's work recognised in this way. Thank you.
Many congratulations to our winners and thank you, judges.
The next category is the Infection Prevention Nurse of the Year. Infection prevention is probably the most important aspect of nursing. It's essential across every single aspect of healthcare, and the role of the infection control nurse is invaluable. Without it, care provision would be impossible. This category is supported by the Infection Prevention Society. On the shortlist we have Gloria Beckett, Oldham Council. Gloria has independently led Oldham's community infection prevention and control nursing throughout the pandemic, supporting care homes, primary care, independent sector providers, schools, children's homes and businesses. Juliet Bale, South East Coast Ambulance Service NHS Foundation Trust. Juliet co-wrote local COVID-19 guidance and national ambulance guidance published by Public Health England and has worked with colleagues from diverse organisations to drive forward quality and service improvements in response to the pandemic. And Susan Rees, Hywel Dale University Health Board. Susan returned from retirement to work full-time, offering her vast knowledge and experience to ensure that patients in care homes were cared for in spite of staff shortages, and preparing homes for outbreak response. She was pivotal in setting up and running testing units in her area. To announce the winners, let's hear from the judges.
I don't think there are really adequate words to describe the experience of IPCNs in the last year. They have, of course, been pivotal to the response of healthcare services to COVID-19 and worked tirelessly to protect patients, create safe systems of working with a huge and relentless workload. For staff working in clinical areas, it's perhaps difficult to understand the enormity of the role. They have to support all services from housekeeping to anaesthetics, but at the same time inform, influence senior management, search for PPE, manage outbreaks, and create solutions to seemingly impossible problems. This year's winner of the award exemplifies its expertise and professionalism. She's been described as someone who leads from the front, embodies a systems approach, and works with energy, commitment, and a calm determination. The winner of this year's award is Gloria Beckett, Infection Prevention Nurse at Oldham Council. Many congratulations, Gloria.
What a year to win such a prestigious award. I just want to say a big thank you to all my colleagues who have acknowledged my contribution to the IP&C agenda over the past 12 months, especially with the most vulnerable in our borough. The huge support and guidance that I received from my colleagues and peers throughout this time made my work so much easier. So firstly, I want to say a big shout out to the wider support team in Greater Manchester, which includes the Health Protection team, as well as my Greater Manchester IP&C nursing colleagues. Last but not least, I just want to say a big thanks to all our providers and especially Team Oldham, as I know I couldn't have done this without you.
Big congratulations, Gloria, and thank you, judges. Back to you, Ranj.
The next category is for the Mental Health Nurse of the Year. With 1 in 4 people experiencing a mental health problem every year in the UK, the NHS is heavily reliant on mental health nurses. The work they do day in, day out is invaluable, and this award aims to recognise that. This category is supported by the Mental Health Nurses Association Unite. On the shortlist we have Nursing Home Team Northumbria Healthcare NHS Foundation Trust. This team has redesigned the way in which care homes in North Tyneside are supported with a traffic light referral screening tool to assist carers responsible for patients with dementia and other mental health needs. This manual has been invaluable during the pandemic when face-to-face visits to homes have been reduced. Jane Anderson leads Teaching Hospitals NHS Trust. Jane offers holistic care to patients with head and neck cancers who also have mental health issues. Working with the Mental Capacity Act team, she has contributed to the development of policy and supported ward staff caring for patients who've benefited from a coordinated approach. And Alison Welfare Wilson, Kent and Medway NHS and Social Care Partnership Trust. Alison has devised and driven a co-produced piece of work on the issues faced by trauma sufferers who find face coverings problematic. This has raised awareness of these problems and prompted mental health professionals to seek solutions. To announce the award, please welcome our judges.
On behalf of Unite the Union and the Mental Health Nurses Association, I want to say how pleased we are to be involved in the 2021 British Journal of Nursing Mental Health Nurse of the Year Award. Having spoken to last year's winner, Lindsay Kahn, we know what an impact winning the award had on her. Whilst this year's winner is certainly really worthy of the accolade, we first want to say a big thank you to all those mental health nurses across the UK who have done so much over the last 12 months supporting people through what has been an even more difficult time for our country. We know the amazing nominations for all the mental health nurses in this category were just scratching the surface of the huge difference you make to people's lives each and every day. Without further ado, I'm honoured to announce that the winner of this year's British Journal of Nursing Mental Health Nurse of the Year Award is Jane Anderson. Our warmest congratulations, Jane.
I'm so very delighted and honoured to receive this award. I'd like to thank all my colleagues in the Head and Neck CSU at Leeds General Infirmary for the fantastic support. I'd like to thank Deborah Hall, our Head of Neck for the CSU and for Neurosciences, for her ongoing support. I'd like to thank Professor Anastasios Kanatas and Dr. Joshua Twigg for their fantastic encouragement and belief in my research projects. Finally, thank you to my family and thank you to you all.
Thank you and many congratulations, Jane.
The next category is Nutrition Nurse of the Year. Nurses are fundamental in providing nutritional support and information to patients and are on the front line when it comes to identifying and addressing their needs. This category is supported by the National Nurses Nutrition Group. On the Nutrition Shortlist of the Year, we have Mahmoud Al-Khalideh, the University of Jordan. Mahmoud has developed a research plan for advancing nutritional practice in the critically ill, which has not only improved patient outcomes, but has also enabled nurses to enhance their knowledge, confidence and performance. Sue Green, Bournemouth University and Solent NHS Trust. Susan's contribution to nutrition nursing encompasses professional practice, research and education. Her knowledge, skills and experience in these areas enable her to lead the development of high-quality educational, research and practice outputs, that enhance nutrition education and promote good nutritional care of patients, whilst also supporting colleagues and carers. And Liz Anderson, Buckinghamshire Healthcare NHS Trust. Liz is a passionate advocate for both nutrition and nursing who leads by example by providing a very personalised service to patients with complex needs and sharing her passion with all members of the MDT. To announce the award, let's hear from the NNNG.
Hi, my name's Claire Campbell and I'm Chair of the National Nurses Nutrition Group. It's always an honour to be involved in the British Journal of Nursing Awards and to read about all the great work that you've been doing across the last 12 months. Looking through the entries is always really inspiring, especially to read about all the positive outcomes that's had for patients as well. So the standard is always really high and this year was no exception, so congratulations to everybody who was nominated in this category. But there can only be one winner, and it gives me great pleasure to announce that the winner of the British Journal of Nursing Nutrition Nurse of the Year Award goes to Dr. Sue Green of the University of Bournemouth and Solent NHS Trusts. Her work across education, research and clinical practice has had a massive outcome for those patients and also the staff working within the MDT. So congratulations, Sue, a well-deserved award. Brilliant.
Hello, my name is Sue Green and I'm delighted to have been shortlisted for the Nutrition Nurse of the Year category for the British Journal of Nursing Awards 2021. I'm absolutely passionate about ensuring that patients get good nutritional care, and I support this through my activities as a nurse educator, as nutrition nurse in a home enteral nutrition team and as a researcher. Thank you.
Thank you and congratulations, Sue.
The next category is the Oncology Nurse of the Year. Many people's lives are touched by cancer, and whether they practice in hospitals or the community, nurses will find themselves caring at some stage for people with cancer. This category is supported by the United Kingdom Oncology Nursing Society. On the oncology shortlist we have Breast Care Team, Northern Devon Healthcare NHS Trust. In the absence of a breast surgeon, the team stepped up to offer a symptomatic 2-week wait assessment clinic to over 1,200 patients, saving them from having to travel outside their area for diagnosis. As a remote hospital with a largely elderly clientele, this was an essential service to avoid diagnostic delays and the attendant detrimental consequences. Kathy Holder, University Hospitals Birmingham NHS Foundation Trust. In spite of her own serious health issues, Kathy has worked untiringly to improve patient care in her field and has helped to set up the Ward 19 Charity Fund, which has raised thousands of pounds to provide much needed equipment as well as funding nursing education and university courses. And Claire Taylor, London North West University Healthcare NHS Trust. For her PhD, Claire investigated the lived experience of post-operative colorectal cancer patients, leading to a greater understanding of the issues they face and enabling more effective support. She's also played a key role in the development of patient literature for Macmillan. We will now hear from UCONS to announce the winner.
So this year I had the pleasure of judging the Oncology Nursing Awards on behalf of UCONS. Judging and providing a shortlist for the award was a hard task. They were individual nominations that recognised the compassionate care that is being delivered to cancer patients from the perspective of the colleagues that nominated them, and certainly some brought a tear to my eye. The team nominations raised the awareness of how services had been developed or maintained this year to continue and strive for excellence in cancer care. So without further ado, I would like to announce the winner of the award, which is the Breast Care Nursing Team, North Devon Healthcare NHS Trust. Congratulations.
On behalf of the Breast Care Team, Claire, Karen, Amy and Abby, we feel very honoured to receive this award. We are a small, dedicated and passionate team of breast care nurses situated in a rural trust in North Devon who found themselves in an extraordinary situation. By utilising our advanced skills and collaborative working with the Breast MDT, we were able to maintain the 2-week wait breast cancer clinics locally with confidence, competence and compassion, even through the added challenges of a COVID pandemic. Thank you.
Thank you and congratulations to the breast care team at North Devon Healthcare NHS Trust.
We now move on to the Renal Nurse of the Year. Kidney disease is often something patients endure their whole lives, and engaging and supporting them in their care is crucial to the quality of life. This category is supported by the British Renal Society and the Association of Nephrology Nurses. On the shortlist we have Anne Elizabeth Grace, Walsall Healthcare NHS Trust. Liz has used her 17 years' experience in nephrology to establish an education programme and provide support to patients, GPs and palliative care staff. This has improved the prevention, early detection and management of acute kidney injury. Tricia Sutherland, NHS Ayrshire and Arran. Tricia has transformed the care of patients by focusing attention on what patients actually want and need. She has ensured that patients have access to services and support in the community and assisted them to develop future care plans. And Lindsay Bibby, Spectrum Community Health CIC. Lindsay observed that HMP Preston had no on-site dialysis equipment and set about rectifying the situation. This not only improved access to care for patients, but reduced the need for external hospital appointments, resulting in significant time and cost savings to the prison. To announce this award, please welcome our judges.
The first historical description of dialysis was published in 1913, but dialysis as a long-term treatment wasn't established until the 1960s. It was during this era that the role of the renal nurse began to develop, and how we've moved on over those years. We are now central to the functioning of the multidisciplinary team, and our roles have diversified to embrace the whole of the patient journey, beginning to end. As 3 judges with over 84 years of experience between us in renal care, we were highly impressed by the submissions for this award.
The judging panel and I were very impressed with the shortlisted nominees for this award category. The high standard highlights the incredible work being undertaken by renal nurses across the country, especially during such challenging times.
Good evening. As President of ANN UK and Vice President for Clinical Practice for the British Renal Society, I'm absolutely delighted to be able to be here today to be able to present the 2021 Renal Nurse of the Year Award. As my co-judges have already alluded, we had some excellent nominations for this year's award. However, there was one outstanding nomination, and it gives me great pleasure to present the 2021 Renal Nurse of the Year Award to Tricia Sutherland from Ayrshire and Arran. Congratulations, Tricia. Sorry I can't be here in person to give you the award, but very well done for all your achievements and the service that you've created. Thank you.
I feel very honoured and humbled to receive this award. I'd like to take this time to thank my colleagues, Dr. Pamela Mackenzie, Laurie Kirkland, Rachel Cox and all of the renal team for their continued support over the last 2 years. Many thanks also to Kidney Care UK. Without their funding, the development of this programme would not have been possible. I look forward to many more years of working with the Renal Supportive Care Service with NHS Ayrshire and Arran. Thank you.
Thank you and congratulations, Tricia.
The next category is for the Respiratory Nurse of the Year. Nurses working in this field face an ever more challenging workload as the patients they care for become older and frailer, with comorbidities that complicate their lives and overall functioning. This award is supported by the Association of Respiratory Nurse Specialists. On the Respiratory Nurse of the Year shortlist we have Neil Jarvis, the Royal Wolverhampton NHS Trust. Neil has led the Wolverhampton team to great achievement since he became team manager in 2018, greatly improving patient outcomes, and during the pandemic led a new COVID ward with great sensitivity and compassion for staff and patients. Joanne Hamilton, Brearley Hill Health and Social Care Centre. Joanne has worked tirelessly over 31 years to equip nurses with the knowledge and expertise to provide first-rate care to respiratory patients, enabling them to attain or recover optimal health and quality of life. And Lindsay Berry, East Kent Hospital's University Foundation Trust. Lindsay has transformed the cystic fibrosis team into a state-of-the-art service with a huge impact on patient care in all aspects of the patient pathway, resulting in a great improvement in confidence in the service. To announce the award, please welcome our judges.
As the Vice Chair of the Association for Respiratory Nurse Specialists, it's been a pleasure to judge the British Journal of Nursing Respiratory Nurse of the Year Award, particularly this year, the Year of the Nurse. The last year has brought an enormous challenge to nursing, indeed the NHS, where respiratory has been thrust into the forefront to deal with a pandemic like never seen before. Whilst managing these exceptional demands on our healthcare system, respiratory care and nursing has never been more important to those living with long-term disease. Managing the needs between acute respiratory care and chronic management has been challenging to all, which is why it's been so enjoyable to read the outstanding and innovative care being delivered to our respiratory patients.
As the Chair of the Association of Respiratory Nurse Specialists, it is a great honour to present the award for the Respiratory Nurse of the Year for the British Journal of Nursing. The respiratory nurse that this award goes to has shown amazing leadership in their field with the transformation of their service. They have shown inspiration to others by educating and presenting their work to empower others to achieve. The award goes to Lindsay Berry from East Kent Hospital's University Foundation Trust. Congratulations, Lindsay.
Thank you so much for presenting me with this award. I'm truly honoured just to be shortlisted, and all the other nominees are really worthy winners. I'd like to say a big thank you to Dr. Tim Newsom for nominating me for this award and supporting me through my respiratory career. Also a big thank you to anyone else I've worked with within children's respiratory. You're all doing an amazing job. A big thank you to my supportive family also, but I should mention the children and families that I work with every day. You inspire me to make improvements to the service. Thank you for this award.
Congratulations, Lindsay, and thank you very much to ARNS.
Our next award is the Vascular Access Nurse of the Year. Intravenous therapy is a specialised field of clinical care that's being carried out in an expanding range of inpatient and community locations. This category is supported by the National Infusion and Vascular Access Society. On the Vascular Access shortlist we have Anne Ho, Great Ormond Street Hospital for Children NHS Foundation Trust. Anne has set up and developed the CVA team in order to provide patients requiring vascular access with the best care and has introduced a robust education programme to ensure that practice is observed and disseminated. Gemma Munoz-Muzzers, the Royal Marsden NHS Foundation Trust. Gemma is passionate about providing a high-quality vascular access service to all patients, and her excellent technical skills enable her to take a holistic approach to patient care, whilst also teaching and mentoring junior colleagues. And James Watling, the West Suffolk NHS Foundation Trust. James is responsible for the implementation of a clinical skills and simulation extension to the Trust's Education Centre, enabling healthcare professionals to learn vascular access in a safe environment. He also volunteers as a first responder, bringing his expertise to the most serious trauma and medical emergencies. To announce the award, we will now hear from NEVAS.
Andrew Barton here, the chair of NEVAS. It's been a great pleasure to judge the Vascular Access Nurse of the Year Award for the British Journal of Nursing. There were lots of applicants this year and it was a really difficult decision, but we have decided on a winner, and it's my great pleasure to announce that Anne Ho from Great Ormond Street Hospital for Children NHS Foundation Trust is the 2021 Vascular Access Nurse of the Year Award. Congratulations, you've done an amazing job.
Thank you so much for this Vascular Access Award. It's an honour to be nominated and totally unexpected. I'm really lucky to love my work and I'm privileged to work with children and families every day. Vascular access is a passion of mine and something the majority of children at GOS need, and I have to get it right every time. I work with such a fabulous team. They're there for the sad times and more importantly the good times. Without them, I couldn't do my job. Thank you again to everyone.
Thank you and many congratulations to Anne.
The next award, Wound Care, recognises multidisciplinary best practice in the prevention, treatment and management of wounds. Wounds are hugely debilitating and can negatively impact on patients' quality of life. The work nurses do in this field is essential and life-changing. This category is kindly supported by Wound Care Alliance UK and the Journal of Wound Care. On the shortlist we have Mid York's Lower Limb Wound Care Clinic. This team has established a community-wide pathway and service for patients with lower limb ulceration, ensuring that patients receive timely assessment and treatment and reducing the workload of practice and community nurses. Leslie Newport, Tissue Viability Skin Team, and Danny Roberts, Centre for Perfect Care, Mersey Care NHS Foundation Trust. This team has created and delivered a digital skincare service and training package, which has ensured that staff are working within best practice and in line with NICE guidelines to optimise patient care and safety. And Promise, Cornwall Partnership NHS Foundation Trust, Live Well South West, Somerset NHS Foundation Trust and Torby and South Devon NHS Foundation Trust. Promise, pressure reduction through continuous monitoring in the community setting, have explored the impact of continuous pressure monitoring for patients with pressure ulcers, which has led to a better understanding of the positions and support surfaces likely to reduce the risk of ulcers developing and aid the healing of existing ulcers. To present the award, please welcome Wound Care Alliance UK.
This year it was a great honour and a privilege to be asked to judge the British Journal of Nursing Wound Care Nurse of the Year. As always, it was a really difficult task. It never fails to amaze me the amount of innovation in practice that I have seen, especially in these extremely tricky times. This year's winners have been extremely innovative, and without further ado, I would like to announce the winners as Adele Barstow, Claire Barker and Donna Slater, collectively known as Mid Yorkshire Lower Limb Wound Care. Congratulations.
Hi, I just want to say a great big thank you from everybody here at Mid Yorks for selecting us to be the winner of this really prestigious award. This wouldn't have been possible without the hard work of Donna, Adele and Claire within the Lower Limb Wound Clinic. Unfortunately, they're slightly camera shy, so I just want to say a massive thank you very much for their hard work and also for the British Journal of Nursing for selecting us. Thank you.
Thank you and congratulations Adele, Claire and Donna.
The next category is innovation, ranging from extending the boundaries of nursing practice to setting up new services that improve patient care. Nurses are developing innovative services and creating new roles in healthcare. The category is kindly supported by Cavell Nurses Trust. On the shortlist we have Healthcare Centre Team, Lloyds Pharmacy Clinical Home Care and NHS Royal Surrey Hospital. This team offers a full end-to-end model of care for the delivery of vital medication without the need for hospital visits, reducing the strain on hospital resources and providing a convenient and effective service to patients. Acetic Drain Service, Huddersfield Royal Infirmary. Ward manager Donna and her team developed the acetic drain service to reduce the necessity of patients being admitted to hospital and frequently having to stay for prolonged periods. This has improved quality of life, mental health and general well-being for many patients. And Andrea Zekretar, Oxford University Hospital's NHS Foundation Trust, Nuffield Orthopaedic Centre Theatres. In response to a serious incident in 2018, Andrea created illustrated instrument folders to facilitate an easier, quicker and safer enhanced instrument count process. This ensures that instrument trays are more closely aligned to specific procedures, reducing patient anaesthesia times and avoiding confusion which could potentiate accidents. To present the award, please welcome back Chief Executive of the Cavell Nurses Trust, John Orchard. John, can you please tell us the winner?
Hello, I'm John Orchard, Chief Executive at Cavell Nurses Trust, and we are very proud to sponsor the Innovation Award at the British Journal of Nursing Awards this year. And I'm delighted to let you know that the winner of the Innovation Award is the Ascitic Drain Service at Huddersfield Royal Infirmary.
On behalf of myself and the team of Ward 17, I am honoured and humbled to receive such an inspiring award. This service has changed the lives of so many people and given them time to spend with their families and loved ones. The control over their illness has given them freedom, better health and longer time to live. I am eternally grateful for the support and encouragement of those around me. Thank you so very much, I am humbled.
Congratulations, Donna and the team, and thank you, John.
Our penultimate category is one of our most prestigious, the Nurse of the Year. This category is kindly sponsored by the Nursing and Midwifery Council. On the shortlist we have Edisil LaRusso, St George's University Hospital's NHS Foundation Trust. Edisil responded to the COVID crisis by promptly and smoothly moving her clinic out of the hospital to prevent infection amongst patients and staff. She also played a big part in ensuring that her trust became an exemplar site for venous thromboembolism prevention. Jerry Mortimer, University of Derby, and Yvonne Francis, Guy's and St Thomas's NHS Foundation Trust. Jerry and Yvonne worked extremely hard for several years to bring about the publication of the Venesection Best Practice Guidelines in 2020. These guidelines have assisted in standardising the care of thousands of patients every year. And Samantha Dorney-Smith, Pathway and Queen's Nursing Institute. Sam has worked tirelessly for 17 years to improve access and quality of healthcare for those experiencing homelessness, ex-prisoners, vulnerable migrants and sex workers. She has played a large part in raising awareness of these issues through campaigning and publications. To present the award, please welcome the Nursing and Midwifery Council.
Hello, my name is Andrea, Chief Executive and Registrar of the Nursing and Midwifery Council, and we're absolutely delighted to be sponsoring Nurse of the Year for 2021. Our judges were looking for something special, something that's made a real difference. And of course, every nurse has been special and has made a real difference over this past year as we've tackled the coronavirus pandemic. So it's a great tribute to their work that Edisil, Samantha, Jerry and Yvonne have all been nominated for this prestigious award. I'm absolutely delighted to announce Jerry Mortimer from the University of Derby and Yvonne Francis from Guy's and St Thomas's as the winner for this year. So many congratulations to you both.
We are delighted and honoured to accept this award. It's a combination of 3 years' work, little appreciating when we set off on this track that we would receive this accolade, so thank you.
We'd also like to thank the 200 or so nurses and healthcare practitioners from across the UK and Ireland whose valuable input helped develop these guidelines for venesection and increase the standard of venesection practice and care.
And we'd also like to thank the Royal College of Nursing and the genetic hemochromatosis community for all of their support and encouragement. Thank you.
Thank you and huge congratulations to our Nurses of the Year, Jerry and Yvonne.
Lifetime Achievement is our final award. This highly prestigious award is given to an individual who has made an outstanding contribution to nursing over many years. To present the award, please welcome back BJN's Editor-in-Chief, Professor Ian Peat.
The British Journal of Nursing Lifetime Achievement Award. Hello everybody. Playing a part in the well-respected BJN Awards ceremony, in whatever role, is always an immense joy and a pleasure. and being able to announce the recipient of the prestigious Lifetime Achievement Award is way up high on the agenda. By making this award available, the Mark Allen Group recognises the recipient's outstanding and lifelong commitment and contribution to individuals, families, the nation's health and well-being, and to our profession. This year's Lifetime Achievement Award goes to a woman who has played a massive part in shaping and influencing health and care provision globally, within the UK and regionally. She remains passionate about improving health services. She was born in Barbados, and in 1963, aged 20, she arrived in England on a cold, grey August day. She trained as a nurse and qualified at the Whittington Hospital, London, and later took up a staff nurse's post working in a high dependency ward. She became a night sister, and then in 1977 she qualified as a health visitor. Whilst working as a health visitor, she managed community nursing services and clinics in Southwark, London, before aiming even higher. In 1987, she made an application for the job of Assistant Director of Nursing in Greenwich, and she was successful with her application. Such an achievement in the 1980s was unheard of for a black person. Later, she became the Director of Nursing and the first black person to hold that post in London. In this role, our winner created policies, reorganised work systems, and adapted the nursing service to ensure that it met the patient's changing needs in a meaningful way. In 1994, she then joined the Department of Health, where she advised on policy, and a year later, she became the Chief Nursing Officer's private secretary. She'd cracked that glass ceiling that so many black and Asian minority ethnic nurses still face today. During her 10 years at the Department of Health, as well as providing input to policy development in a number of areas, including public health and the inequalities agenda, Black and Asian minority ethnic healthcare, and the Mary Seacole Leadership Award that was funded by the Department of Health, she supported nurses in their leadership development. In 2000, she was justifiably awarded an OBE in the Queen's Birthday Honours List for her services to nursing. Other notable accolades, and there are very many, include the Windrush Award and the European Black Businesswoman Award for her work in healthcare. In 2003, she was awarded an honorary doctorate by the University of Birmingham, which was previously the University of Central England. And in 2004, she won the Wainwright Trust Award for her work on equal opportunities in the NHS. And in 2006, she was included in a National Portrait Gallery exhibition that depicted 16 outstanding women and men who had been influential in shaping healthcare in England. The winner can now add the BJN Lifetime Achievement Award to her already impressive collection. A mentor and a friend to many, it is with huge pleasure that I present this prestigious award to Dr. Nola Ishmael, OBE, a consummate and kind human being. This award is for you, Nola. With much gratitude and respect, you are indeed a trailblazer. Thank you for what you did, thank you for what you do, and thank you for what you are continuing to do. With our most amazing and immense appreciation for all you do. The BJN Lifetime Achievement Award 2021 rightly goes to Dr. Nola Ishmael, OBE. Congratulations.
I would like to thank the British Journal of Nursing and all those who participated in my selection. I stand among a field of exceptional pioneers and trailblazers. I wish to acknowledge and congratulate my fellow nominees and finalists. I am honoured and humbled to have been singled out for this award. When I left Barbados over 55 years ago, I was welcomed into an NHS in its infancy. I endeavoured to study hard and provide as good a service as I could. I progressed through the many levels and worked hard to become a health visitor, ultimately becoming the first BME Director of Nursing in London. I completed my career journey working at the Department of Health, developing policies and working as the professional private secretary to the Chief Nurse of England. I look back at my nursing career with great satisfaction, knowing I did my best. I'm encouraged by the present generation and the promise of an ever-improving NHS. Once again, I thank you.
Congratulations, Nola, and thank you, Ian. Well, that's it. So well done to all of you, especially, of course, the winners. Thanks to the judges for their decisions, and thanks to our sponsors, without whom these awards would not have been possible. Don't forget that you can see interviews with all of the winners throughout BJN Awards week, as well as important educational updates from our sponsors. Thank you and good night.